Hi there. Thank you so much for checking us out here on our YouTube channel today for your medication needs and other medication related questions that you have. And as a way to support our community here at DamiRx Care, we do recommend you subscribing to our YouTube channel. Also, we would like to gift you for subscribing to our YouTube channel. And if you check the description bar below, you'll find a link where you can download a free diet meal that we do have here as you commence on your healthy lifestyle and habits. So let's go ahead and talk about the medication of choice today. So the medication of choice today is known as St. John's Wort. So what is St. John's Wort? So St. John's Wort is a medication that's mostly used in patients who have depression. It can also be used in patients who have a premenstrual syndrome or patients who are having symptoms of menopause or patients who have a seasonal affective disorder. So this is another form of like a mental disorder that happens in patient that this medication can be used for. So this medication as an oral tablet form is used as a 300 milligram dose 3 times a day. And it usually varies depending on how the doctor wants you to take it. So you would definitely want to follow your doctor's recommendation on what dose to take on that medication. This medication does come in a dried tea form. It does come in a dried herb form as well as ointment, gel, capsule, or tablet. It also comes in a tincture or a liquid extract form as well. So these are all forms where you can buy this medication in over the counter. So what are some side effects to look out for when taking St. John's Wort? So some side effects include diarrhea. This medication can also cause dry mouth. It can cause fatigue. It can cause swelling, maybe in like the lower extremities, like the lower limbs. This medication can also cause frequent urination. So you might notice that you're using the bathroom more than often. This medication can also cause stomach upset. So you definitely want to be careful what you take in while you take this medication as well. The medication may cause headaches. It can also cause your skin to increase the more sensitive it is to the sun. So you definitely want to make sure that you're wearing sunscreen or a sunblock cream or ointment, that you're applying that to your skin while you're taking this medication. Also, you may notice a little bit of rash while you're taking this medication, as well as nausea, constipation, and restlessness. So what are some serious side effects that you definitely want to reach out to your doctor for if you start noticing this happening to you? So this medication have been known to cause muscle spasm or tremors in some patients. This can be very severe. So once it becomes very severe, you start noticing it more often, then you definitely want to reach out to your doctor about that. So if you notice any joint stiffness, any muscle spasms or muscle pain that's abnormal, make sure that you're reaching out to your doctor regarding that. Also, if you start noticing any palpitations, any sinus aches, any consistent dryness, you want to make sure that you're reaching out to your doctor regarding this serious side effect. That way they can assess to make sure that you're not taking the medication with another condition that you may have that's contraindicated or you should not be using the medication for, or to make sure that this medication doesn't interact with any of the other medications that you're taking. Also, if you start noticing any increase in suicidal ideation or any like increase in mental illness that you may have, then you definitely want to bring this up to your healthcare provider. So what are other things that you need to know while you're taking this medication? So this medication can also be used in patients who are feeling menopausal symptoms. So patients who are having hot flashes, or other symptoms that's related to menopause, this medication can help with it. This medication does seem to have some serotonin mechanism of action, or it kind of act like serotonin in the body. So you definitely want to watch out if you're already taking other serotonin like medications before taking this medication. Also, like I said before, this medication can increase your skin sensitivity to the sun. So you definitely want to make sure that you're applying some sunscreen, making sure that you're avoiding the sun as much as you can. But if not, like I said, applying some sunscreen or like a sunblock cream on your body before going into the sun. Also, this medication can cause some birth defects, so this should definitely be avoided in patients who are pregnant. A lot of drug interactions can come up while patients are taking this medication, so you definitely want to check with your pharmacist or your local healthcare provider to make sure that this medication is not going to interact with other medications that you're taking. Also, in patients that are taking birth control, this medication can increase the breakdown of the estrogen inside the birth control and can decrease the effectiveness of that birth control, causing you to need a contraceptive in order to avoid pregnancy completely. Also, this medication can cause some abnormal menstrual bleeding in between your period. So make sure that you're reaching out to your doctor if you start feeling these symptoms. That way they can assess and make sure that this is a side effect of the medication or from the medication. That way you can discontinue that medication and they're able to substitute the medication with another for you. All right. And also in patients who have a history of eye disorder, this medication can increase the risk for cataracts in those patients. So you definitely want to make sure that you are not taking this medication if you have a long history of cataract, or if you've had cataract and gotten it removed before, then this is definitely not a medication of choice for you. So you want to reach out to your healthcare provider and see what other substitutes are out there depending on what you're treating, so they can point you to the right direction. All right, so I hope I was able to help in terms of what to look out for while taking this medication. This is definitely a go-to homeopathic medication to use if you don't want to go, the pharmaceutical product route for your depression or any of the indications that I mentioned earlier, such as the seasonal affective disorder or menopausal symptoms. So this is definitely worth a try. But like I said, make sure that you're reporting this to your healthcare provider. That way they know that you're taking this medication, and making sure that they're not prescribing you any other medication that can interact with this drug. Thank you for watching, and please stay tuned.